mentioned, I'm an orthopedic surgeon. I am not the one at the moment, at least, who is posted in a COVID ward. So I think I would be just talking about my perspective uh, as a healthcare personnel. So when I go to the hospital and I see the patient, I need to know whether that patient has any travel history or any suspicion signs of COVID, so that I'm not denying the patient, but at least I can manage the patient and I can prepare myself, and not just myself, but every healthcare staff who's working in the hospital can prepare themselves even at this point of time. So I think the best way, I mean, we can't do coronavirus test for every patient who enters the hospital. And I think it is a very simple way. I mean, if Aarogya Setu app delivers what it is supposed to deliver, and if everyone has it, at least those patients who are orange or red, it would be notified. Then we would be prepared. And I'm not saying just in the hospital, but probably outside the hospital and in community as well. But well, let me give you one example, which actually I read, I think last week. It was one of the government hospitals in Delhi, in which there was a patient who was a pregnant lady who came to the hospital with some complication. She underwent a surgery. She was transferred to the ICU. But all this while, she never disclosed her travel history. She never disclosed that she has been actually been quarantined for being suspected of coronavirus. Eventually, they did a test for her, and she turned out to be positive. Well, as a result of that, I think 68 medics were actually quarantined. And that hospital, you just imagine in a busy government hospital, I mean, if there are 68 healthcare workers who are quarantined, well, we are actually working with almost half the efficiency of the hospital. So I think in that sense, had that patient not told the history of being positive, had she just underwent a uncomplicated minor surgery, has been in contact with 68 people, gone back home without even informing her status, well, it would have been even more dangerous. Because in that circumstances, I mean, a domino effect would have arisen. All those 68 people would have seen a lot more patients, which has actually happened in a lot of parts as well. And some of them might have been asymptomatic, but definitely they would have transmitted the virus had they turned out to be positive. So I think at this point of time, it is very important for us to be aware, to know who are the contacts, and especially when we are talking about opening the lockdown, when we are lifting all the barricades and when the hospital would start flooding again with the patients, we should be very cautious about who we are seeing in what circumstances. We would not have PPE for every patient. We don't really want all the patients to be sitting together. I mean, when I am sitting in my clinic, for example, and I have a small, for example, I just have like a 200 square feet waiting area. I need to maintain social distancing. And if some such patient comes who actually would be suspected of having coronavirus and does not have the app, I don't know the status. The patient turns up and infects everyone in the clinic, as well as as well as infects me, and I infect every other person that I see. I actually feel jolted to think about that happening, and it has
Right.
actually happened. This was discussed before only, that I think in the previous forum, that what if the patient does not disclose his own identity. Now, as it was mentioned before, that the data that we're talking about, I mean, I'm assuming that the patient would actually not disclose his identity, and specifically with regards to the past medical history. I don't think at this point of time the app is equipped enough, but because we have an integration with the ICMR, which would tell whether the patient is COVID positive, as well as NCDC, which would help us in finding that the patient has come in contact or probably is in quarantine. So I think in that sense, the patient would not have control to manage these things. This is what my understanding of this app is, and I'm sure Arnab can detail on it in a better manner. So I think despite everything, we would still be able to siphon out who are at-risk candidates.